The most controversial opinions that I've probably ever shared on this channel are waiting for you at the end of this video. But first, I want to tell you about my friend Bob from Connecticut. Bob developed cataracts in both of his eyes, which caused, as you can imagine, blurry and cloudy vision. But the real-life practicality of this meant that Bob couldn't see the world in the vibrant brilliance that he'd loved his entire life. Bob would plan his daily activities around making sure that he left certain events or gatherings early so that he wasn't driving at night to keep him and other drivers safe. Reading, writing, watching his favorite Medicare YouTube channel, all of these activities and others were affected by his cataracts. So his doctor recommended cataract surgery. Most of us are pretty wary of anyone getting near our eyes, which Bob was too, but another question came to mind, and that was, how much is this going to cost me? The biggest problem with healthcare in America, in my opinion, is the lack of price transparency and the idea that if you go to your doctor and ask, how much is this procedure going to cost me? The answer you will get is, I don't know. It'll depend on your insurance. Imagine any other service in the world, buying a car, ordering a meal, buying a new outfit. And when you go to ask the salesperson, waiter, or department store clerk, how much is this going to cost me? They tell you, I don't know, but you need to sign this contract first, committing to buy it at whatever price we say, and then we'll send you a bill in about a month that you're legally obligated to pay. Would you like fries with that? Now, Bob wanted to help others considering cataract surgery, so he sent me the actual statements with the real costs, and I'm going to show you how this would be handled by various Medicare plans like Supplement Plan G, Plan N, High Deductible Plan G, and a typical Medicare Advantage plan using Bob's cost numbers and average plan costs in his area of Connecticut. If you've ever wondered how these different plans cover different things, that's what this video and others on our channel are for. The trusty whiteboard is here for us again, and be careful skipping to the end of the chart and stopping there. We have very important takeaways that are more than just the final dollar numbers. To further complicate how hospital and insurance billing works, we have a billed amount, an approved amount, and an actual Medicare or insurance paid amount. I'm oversimplifying this, but the hospital usually submits a billed amount of a very high number. Medicare says, that's nice, but we're going to pay a third or a half of that. The hospital says, okay, we knew you weren't going to pay that much, and that's the number that we work off. Your costs are going to work off the negotiated amount, not the billed amount. So as you see these super high sticker prices, know that your insurance will be bringing those numbers down through negotiations and contracts if you are visiting providers who participate with Medicare or your insurance plan like an Advantage plan. If you go out of network, these sticker prices become much more relevant to you. We are starting with the assumption that Bob had not yet met any of his deductibles when going for these visits and the surgery. A deductible is a dollar amount that you need to pay first before insurance kicks in, and you'll see what I mean by that as we go along. Starting off, Bob had a consultation with his primary care physician and 2 consultations with the eye specialist. These are all Medicare Part B charges. The total billed for all 3 visits was $761. Medicare says, that's cute, we'll pay $283.60. I'll round that to $283, and this is accidentally perfect. With Supplement Plan G, Plan N, and High Deductible Plan G, all of these plans do not cover anything until you have paid the Part B deductible. This all happened in 2025, but the 2026 Part B deductible is $283. So this somehow worked out to perfect math for us to where Bob and you are responsible to pay that deductible first, and it is working off of that negotiated amount again, so that first $283 is left for you or a friend Bob to pay to fulfill the Part B deductibles on Plan G, Plan N, and High Deductible Plan G. Traditionally, most, not all, but most Advantage plans do not have medical deductibles. 2026 has seen the introduction of more medical deductibles across Advantage plans, so this will definitely be influenced by where you live and the plan that you pick, but most do not. Advantage plans instead have copays or co-insurance amounts for most of the services. Looking at the plans in Bob's area, none of them had a primary care provider visit copay. All of them had specialist visit copays. The average across the 8 plans that I looked at was a $45 specialist copay. There were 2 specialist visits, so $90 in out-of-pocket costs for the visits going the Advantage plan route. Another important thing to consider with Advantage plans would be the maximum out-of-pocket. All Advantage plans will have a maximum out-of-pocket limit where once you pay that amount out of your own pocket, you don't have any more cost responsibility for approved services for the rest of the year. You meet that max out-of-pocket with things like these copays and coinsurance amounts, so that $90 comes off of the max out-of-pocket number. Maximum out-of-pocket is often shortened to a funny-sounding acronym, MOOP. The average MOOP of the plans that I looked at in Bob's area was $6,300, leaving $6,210 left to meet the MOOP. The average nationally for 2026 is around $5,900. Next, we have the surgery itself. There are several different charges that go into a surgery like this, like equipment, anesthesiologists, and others, but all of these things are Part B charges and totaled $24,600 for both eyes, about $12,300 per eye. Medicare laughed in that general direction and said, we're going to pay $6,800 total or $3,400 per eye. We have already met the Part B deductible on the Supplement Plan G, so no more Part B out-of-pocket dollars for you or Bob here for the rest of the year. Medicare Part B covers 80% or $5,440. The Plan G pays the other $1,360. Same for Plan N. No more out-of-pocket costs here for you. Medicare Part B covers that 80% or $5,440. Plan N pays the other $1,360. High deductible Plan G is a bit different. The high deductible for 2026 is $2,950. Your Part B deductible payment does count towards that, so we have $2,667 left to meet the high deductible of Plan G, but here's where things get a little weird. You have met your Part B deductible, so now Medicare Part B is kicking in and covering 80%, that $5,440 of these procedures. $1,360 is left, and it is sent to you or your plan. In this moment, we're talking about high deductible G. So you would pay that $1,360 out of your own pocket because you have not yet met your high deductible. That amount comes off of your remaining deductible total, leaving $1,307 left towards your high deductible Plan G deductible. The mistake that many people make is that they take the $6,800 Medicare negotiated amount and they throw that over to your high deductible Plan G remaining balance. But it's not the $6,800, it's 20% of that because you pay the Part B deductible. Medicare Part B takes care of 80% first. And then finally, an Advantage plan typically handles outpatient surgeries like this with what is referred to as an outpatient copay. Some will have coinsurance, and the difference between a copay and coinsurance is significant. A copay is a fixed dollar amount. Using plans in Bob's area, the average outpatient copay was $425 for each procedure. Remember, Bob had both eyes done on separate days, so a total of $850 in copays. This amount goes towards that max out-of-pocket, leaving $5,360 left. There are Advantage plans that have outpatient coinsurance, like 20% as an example of the cost rather than a fixed dollar amount. In this case, with Advantage plans, they replace original Medicare, and they do not get that 80% discount that supplement plans get on the negotiated amount. The Advantage plan takes on the full $6,800 cost. So if there is a 20% coinsurance, that would be $1,360 that somebody on an Advantage plan with this coinsurance level for outpatient procedures would be responsible for out of their own pocket. So pay attention to how your plan is structured. This is what we do and why we caution against using call centers or just picking the lowest premium plans. Copays for outpatient procedures are more common, but again, 2026 saw an introduction of more coinsurance model plans, so pay attention to your plan details. Okay, Bob had 2 follow-up visits with his specialists after the procedures. The total billed for both combined was $666. Medicare agreed to pay $220. With Plan G, no more costs. Part B handles 80%, and the other 20% or $44 is covered by Plan G. Plan N gets tricky. Plan N comes with an up to $20 copay for doctor visits, but this applies for certain doctor visits and boils down to about 20 billing codes. More specifically, the Plan N copay applies to doctor visits for the purpose of diagnosis and treatment. The billing codes that I saw for this follow-up visit did not fall under the billing codes used for Plan A copays. So in this case, no more cost for Plan N. However, there is a specific ophthalmology CPT code that can fall into this copay. The initial pre-op visits were for diagnosis and would have fallen under the right billing codes to potentially warrant a copay, but those costs were looped into the Part B deductible first. Plan A copays come after someone meets the Part B deductible. With high deductible Plan G, the deductible is still not yet met, so the 20% that Part B does not cover comes over to you, and you are responsible to pay that $44, leaving you with $1,263 remaining for your high deductible. With the Advantage plan here, we've been here before. We have 2 more copays for the 2 specialist visits at $45 each or $90 total, which goes towards that max out of pocket, leaving $5,270 left to meet the max out of pocket. We are not done, and this is one of the biggest mistakes that I hear from people trying to convince their friends or people in the comments or even me as to which plan is less expensive. People on Advantage plans will say, I only paid $1,030 for 2 eye surgeries. Or Supplement Plan G or Plan N folks will say, I only paid $283 for 2 surgeries. Plan F friends will say they didn't pay anything because Plan F covers that Part B deductible. But all of these numbers are incorrect. We have to talk about the monthly premium costs just for you to have these plans if you really want to know what it actually costs you. The first is the Medicare Part B premium. In order to get any supplement plan or Advantage plan, you must have original Medicare Parts A and B. 99% of Americans do not have to pay premiums for Part A. Most do need to pay for Part B. The base premium amount in 2026 is $202.90 per person per month for a total of about $2,435 for the year. Part B premiums are based on your income. So if you are low income, think Medicaid, yours could be less. If you are higher income, there is something that you need to worry about called the Medicare Income Related Monthly Adjustment Amount, or IRMA. Here's a chart that shows you the income ranges, your tax filing status, and the Part B premium amounts. They look at your tax returns from 2 years prior to determine these income ranges. So in 2026, they would look at your 2024 tax returns and your modified adjusted gross income to determine where you fall in these income ranges. These adjust each year, so in 2027, they will look back to 2025, and so on every year for the rest of your life. So we add these costs to our totals, and these monthly premiums do not count towards any max out-of-pockets or deductible amounts. Next, supplement plans have a cost just to own the plan, whether you use it or not. For Plan G, the average across the country right now for a 65-year-old is about $160 per person per month. In most states, that goes up the older you get based on your age, on top of another annual increase that insurance companies do most years to account for rising healthcare costs and inflation. For someone Bob's age in his zip code, it is about $240 per month, Connecticut being one of the higher cost supplement plan states. I've been using numbers from Bob's area, so I'll continue to do so, but know that this amount can be different depending on your age, where you live, and your gender, with female rates being slightly lower than male rates. $240 a month over 12 months is $2,880 additional dollars to add on to the Plan G route for that year in Connecticut. I'm doing annual costs to normalize this. Nationally, Plan N averages about $130 per month for a 65-year-old. In Bob's area and for someone Bob's age, it is around $220 a month or a total of $2,640 for the year. Nationally, high deductible Plan G averages about $60 per month for a 65-year-old, and in Bob's area and for someone Bob's age, it is $62 a month. But I'm going to round that down to $60 a month to make this easier for both of us, and a total of $720 for the year. Connecticut is much more normal for high deductible Plan G premiums than it is for Plan G or Plan N. Most Advantage plans do not have a monthly premium. You will find plans that do. This is, again, highly dependent on where you live, but most do not have a monthly premium to have the plan. In Bob's zip code, there are 29 available Medicare Advantage plans. 8 of them have a monthly premium, 21 do not. So we're going to go with the $0 monthly premium here. This video is focused on just these 2 surgery procedures. So here are your totals for each plan type for these procedures, and look at what seems to surprise a lot of people. You had the least amount of cost sharing with Plan G and Plan N, meaning your out-of-pocket costs to use the healthcare system were only $283. But the premiums to have these plans mean that these 2 options were the most expensive. You had the most cost sharing with high deductible Plan G, but since the premiums of that plan were so much lower than Plan G and Plan N, the overall cost to you was lower. People with high deductible Plan G tend to get a little bit frustrated when they need to use the healthcare system because they keep seeing these bills come through when their friends on regular G or N aren't seeing anything. But the monthly premium difference is substantial. Finally, the lowest cost option in this example was the Advantage plan with the copays and no monthly premiums to have the plan. But remember, Advantage Plan friends, it didn't just cost you $1,030 to have these surgeries. Your real cost is around $3,465. Supplement Plan G and Plan N friends, it didn't just cost you $283 to have these surgeries, or High Deductible Plan G friends, it wasn't just the deductible amounts. It was more costly when you factor in premiums. These are costs that many people just don't want to bring up when trying to convince somebody on a different plan that my plan is better. But if you stop here, you will have missed even more hidden costs that people forget about, as well as, again, what is probably my most controversial opinions on this debate that I've ever shared. The reality of this situation, even with just this procedure, is that those on Medicare have other costs to be aware of. I'm going to put them under here and go over their fixed costs, meaning their monthly premiums just to have them, but each of these have their own deductibles, copays, and coinsurance amounts. The next cost we need to factor in to compare apples to apples is Part D drug coverage. Supplement plans do not include Part D drug coverage. You need to purchase that separately. The average Part D monthly premium is around $35 a month. You will find plans that are $0 a month on up to, I've seen, over $172 per month. In Bob's area, the average across the 10 plans available is $65 per month. I'm going to drop it to the national average of $35 here because inevitably somebody thinks that I'm trying to cheat to make one side look better than the other. So an additional $420 a year added on to each of the supplement plans. Most Advantage plans come with Part D drug coverage included at no additional cost. Those that don't have drug coverage included are specifically made for people who do have creditable drug coverage through other things like the VA, TRICARE for Life, or others. But for most people, you do not add any additional dollars to have a Part D prescription drug plan included with the Medicare Advantage plan route. Dental coverage is not included with supplement plans. You are not required to have dental coverage, but to try to keep this comparison similar, we're adding it because some form of dental coverage does come with most Advantage plans at no additional cost. To get a standalone dental plan with your supplement plan, the average is around $45 per person per month. You can get discount versions or more expensive plans depending on what you need, but that's an additional $540 each year on top of the supplement plan options. I'm going to bundle that in with vision coverage because, again, vision is not required, but it is here to try and make this comparison similar because most Advantage plans do have some form of vision coverage included at no additional cost. You would have to purchase a standalone vision plan if you wanted that going the supplement plan route. Average cost there is around $20 a month or another $240 for the year for each of the supplement plans. That's an additional total of about $780 for the year to have dental and vision going the supplement plan route versus the Advantage plan route. We can now look at the total annual costs for these plans in the context of having just the surgeries on both eyes and nothing else. No other hospital or medical procedures, no drugs, dental, or vision costs, nothing else. And again, my controversial opinions are coming up. The total billed amount was $26,027. Medicare said, nah, it'll be $7,303. Of that, Medicare paid $5,616. If Bob or you were on a Plan G, you would have paid $6,798 for the year going the Supplement Plan G route. Your Plan G insurance company would have paid $1,404. That company would have collected $2,880 in premiums from you, leaving the insurance company making $1,476 for the year. If Bob or you were on a Plan N, you would have paid $6,558 for the year. Your Plan N insurance company would have paid $1,404. That insurance company would have collected $2,640 in premiums from you, leaving the insurance company making $1,236 for the year. If Bob or you were on a high deductible Plan G, you would have paid $6,042 for the year. Your high deductible Plan G insurance company would have paid $0. That insurance company would have collected $720 in premiums from you, keeping all $720 to themselves for the year. An important thing to point out here is that we are assuming that you did nothing else this entire year, not just hospital and medical costs, but drugs, dental, and vision. With supplement plans, if you were to have prescription drug costs, dental costs, or vision costs, the supplement plan insurance company margins would not be affected by you using these other services. They would be on the next part with Advantage plans. If Bob or you were on an Advantage plan, you would have paid $3,465 for the year. Your Advantage plan insurance company would have paid $6,273. Advantage insurance companies are paid by the federal government. The amounts vary by a lot of factors. The average is right around $1,000 a month, so $12,000 for the year. This means that the insurance company would have collected $12,000 in annual premiums from the government, leaving the insurance company making $5,727 for the year. The difference here is that if you were to use any of those other things like filling prescription drugs, dental care, vision, or others provided by that Advantage plan, those services would reduce the profit margin for that insurance company as opposed to not affecting the supplement plan insurance company margins for those other things. Now it is the time for my 4 most controversial opinions, and number 1 is building off of what I just spoke about, the Advantage plan company profit margins. I am not trying to make excuses for Advantage plan profits or companies or the decisions that they make. It's just important that you understand how this works. There are all kinds of information out there talking about how Advantage plans cost the government, and therefore you and me, the taxpayers, more money than traditional Medicare only. And my opinion is, as my teenage self would say, duh, they should cost more because they take on more risk than traditional Medicare. In our example here, Medicare's cost responsibilities are 80% of the massively reduced negotiated Part B costs, minus the Part B deductible that you had to pay. What is not covered in our example here is that traditional Medicare Part A has a rather large deductible, daily copays, and its own max out-of-pocket for Part A costs. But that max out-of-pocket is not a limit for you on how much you pay. It's actually a limit on how much traditional Medicare is going to pay. In situations where you get up to these numbers, you would be responsible for 100% of the costs, and traditional Medicare, 0. If someone were to have traditional Medicare only, Medicare is not covering prescription drugs, dental, vision, or anything else that Advantage plans typically come with, like telemedicine, gym memberships, over-the-counter dollars, transportation benefits, or whatever else the plans may come with in your area. Advantage plans do cover those things. They are paid to take on that risk, but that means covering these things that cost more than an alternative called traditional Medicare that does not cover these things. People are comparing apples to lasagna. So be careful with people trying to rile you up against one side using that statistic or cost comparisons that are not in context. Advantage plans take on more risk across more areas of healthcare than traditional Medicare only. Supplement plans help protect you from that unlimited risk of original Medicare only by taking on those unlimited Part A and Part B risks, not the other stuff that we mentioned with drug coverage, dental, vision, or others. Controversial opinion number 2. If you have watched this and think that I have a preference for Advantage plans, you would be sorely mistaken. If you just heard that sentence and you think that my preference is for supplement plans, you would again be mistaken. When I talk to anyone about their Medicare decisions, I do not care which one you pick. I do not have a preference for you. You have a preference for you, and my job or my partner's or any other agent or broker that you use has a job of showing you how these plans work and helping you understand how they apply to your situation. If your agent, broker, friend, neighbor, or sibling is pushing you one way or another, politely ask them to stop. Advantage plans will rarely lose the strict dollars and cents battle for single procedure years or even a few procedures in a given year. The little or no monthly premiums coupled with little to no medical deductibles and then together with just having copays for things leave only about 3 to 5% of people on an Advantage plan ever meeting their out-of-pocket max in a given year. Where Advantage plans become more costly to you is if you have a high max out-of-pocket and you have several very high-cost years. The easy examples would be multiple inpatient hospital stays and chemotherapy from cancer. If those are happening, you're likely hitting your maximum out of pocket, and for cancer, likely over multiple years. Advantage plans are managed care, so you are working within networks and dealing with prior authorizations. I have entire videos that go over just this topic in more detail, but we don't have the time for it here. The bottom line is you are paying less in monthly premiums, but you are giving up some control over providers and administrative ease of use. For many, that is worth it to pay little to none in monthly premiums and manageable copays. For others, this trade-off is not worth it. Moving over to the supplement plan side and controversial opinion number 3, in high-cost supplement plan states like Connecticut, Florida, Maine, Massachusetts, Minnesota, New York, Vermont, and Washington, Rarely are high deductible Plan Gs going to lose the cost comparison with regular Plan G or Plan N, especially for those old enough to qualify for Plan F as well. In certain areas of certain states like New York, your monthly premiums for a high deductible Plan G plus meeting your full high deductible amount will still be less expensive than just the Plan G or Plan N premiums. Does this mean that everyone should get a high deductible Plan G wherever you live? No, that is not what I'm saying. And before the last controversial opinion, I have your secret code word for this video, which is haircut. I got a haircut earlier today, so it's fresh on my mind. If you leave any mention of the word haircut, I'll know that you've made it this far, and I can take those comments a little bit more seriously than somebody who's yelling at me and didn't watch the whole video. Okay, the final controversial opinion number 4 will cause some to think that I and fellow agents like me will be put out of business. Your total cost in this year, if you did not have any supplement or advantage plan, but you did keep Part B and Part D just so you avoided penalties, would have been around $4,542 using Connecticut numbers and even lower in most other states. Every insurance company in this example we used would have been profitable, both supplement and advantage plan routes. The concept that you or your insurance company are working off of the traditional Medicare negotiated amount and the 20% Medicare does not cover results in less financial risk than I think most people realize on lower cost procedures. Medicare costs and coverage when compared to non-subsidized ACA plans or non-subsidized employer plans make Medicare very strong coverage at a good cost. This leads some to believe that they should just have traditional Medicare only and no supplement plan or no advantage plan. And that is completely fine for you to have that opinion. My opinion is the opposite because of my relationship with what insurance is meant to be. Insurance is meant to transfer varying amounts of risk from you to an insurance offering. The higher the risk that you transfer within reasonable cost parameters, the more valuable that insurance becomes. If you are paying high amounts of money for something that is highly unlikely to happen, that is a problem. For example, if you are paying any amount of money for alien abduction insurance, which is a real product that you could buy, that is a waste of your money. If you are paying lower amounts of money for something that is highly likely to happen, and it would be expensive if it did happen, this is where insurance is more valuable to you. Part A and Part B, even with highly negotiated, reduced amounts, and even with only 20% of Part B being your responsibility, it is still an unlimited dollar amount of risk to you, which, for a Medicare-age population, healthcare costs as you age are a highly likely scenario. The exact opposite of the I'd never say 0% chance, but essentially 0% chance that you get abducted by aliens. This unlimited dollar amount of risk in healthcare is capped by things like supplement plans and advantage plans. I just showed you how, in this one example, all of these supplement plan options are more expensive than if our friend Bob had just traditional Medicare only and nothing else. The Advantage plan would still be less expensive, but the point is that we help a lot of people get supplement plans. And if you just watch this, you'd think, well, shoot, I don't need one because it would have cost me more to have cataract surgeries than without one. Erik just put him and all of his competitors and supplement plan insurance companies out of business. That would be an incorrect conclusion to this video and any other cost comparison. Your life and the value of your coverage is not for one procedure or two in a single year. For most, it is not 2 or 3 years, but 15 to 20 years of varying levels of low-cost and high-cost healthcare services. I have 2 videos that you need to watch if you haven't seen them already. First, I put together several of these cost comparison examples into one video, ranging from a no-cost year all the way up to hundreds of thousands of dollars in the Medicare negotiated costs in a video that looks like this. In my opinion, it is one of the most valuable videos that I've ever made on this channel for people considering these plans. Second is this video that goes over the 20-year costs of these plans, and there's a free spreadsheet that you can download and play with your own numbers. I will see you over in one of those videos.